With his thoughts on today's announcement, we're now joined by the Premier of New Brunswick, Blaine Higgs. Premier Higgs, thank you for being here. Really appreciate you taking the time.
You're very welcome, Michael. Appreciate the opportunity.
Now, last December, when you and I spoke last, you said you were confident that if the premiers could get a meeting with the Prime Minister, a deal could be hammered out. There's now this proposal on the table. You've had your meeting, but it seems, though, there's disappointment among the premiers.
Well, I don't know that we actually hammered out a deal. We basically were presented a proposal that here it is. And I don't know that that's unique in the history of healthcare funding increases from the federal government. But I will maintain a somewhat optimistic here and basically say that, okay, we finally got together and we finally got a proposal that does include more funding, albeit significantly less than we had hoped for.
Significantly less, as you say. What exactly is missing from your perspective?
Well, certainly we were looking for more of an equity funding partner in the increasing cost of health care that basically lined up what provincial contributions were to federal contributions. And that was the goal. That's why the $28 million we were focused on. But in the sense of what we've received here, it's a recognition that an increase was needed. It is, the health transfers are like 30% of our total healthcare budget. So it's a percentage on a percentage of the budget, and so we basically are in a situation that I would say, well, all increases are welcome. The categories that have been put forward are, certainly reasonable in terms of the bilateral discussions. We can work with that for sure. I think there's a recognition in Atlantic Canada of an aging population, and so that's going to be helpful for us to negotiate on the bilateral agreement. But I think on the other side, it tells us we've got to look long and hard at how we deliver healthcare in Canada and how we're become more innovative in doing that. Better technology, better use of best practices maybe around the world, but across Canada, better sharing of data, better oversight of what we do every day in our respective provinces. I think all of these things, the public probably are saying, there's areas that we can all improve upon. This funding would say you're going to have to figure out where they are.
Okay, so to be clear then, you think that there must be ways that need exploration, a different way of delivering health, because of what's on the table, or because the $28 billion was never going to come to fruition as the premiers wanted?
Because of what's on the table, what we're showing is that, if we're going to continue funding healthcare kind of in the same manner we always have, we needed to have serious funding injection. I mean, we have the labor shortage. We need to have, a whole different approach of maybe certifications and the ability to get more immigrants in that are fully certified coming from countries that are delivering on our program, so we can put them right to work. So we're going to have to do faster certifications and get moved up on that. We're going to have to look at technology and, where we're performing procedures and how we can do them quicker and do them more cost effective. All of this, at the end of the day, has to be done with the fundamental principle that everything we do has to be better outcomes for the patients, and that's the people of our province. And Canadians expect that. So they expect the criteria that was being put forward. They expect it to improve. It's pretty hard to suggest otherwise. And they expect that we can continue to deliver better health care, because our health care system has gone through a significant crisis in many cases, but certainly a challenges in every part of the country. So our population expects better. This funding's not going to do it overnight. We are, and we will need to continue to be, I guess, more creative in how we deliver healthcare better with what's available to us.
So obviously a disappointment, perhaps a rethink down the road. So where does that leave the provinces? What's the next step here?
Well, I think the recognition now is, okay, we've got what we have. Where do we best utilize the money to get the best results? If I look at critical surgeries, whether it be critical surgeries for cancer care, whether it be critical surgeries for hip and knee, we're doing some marathon, surgeries now. Like we go to a hospital, we bring in surgeons, they work all through the weekend, and we ramp up the use of that facility, and the surgeons seem to like that. And I've said I've said many times that we'll spend whatever money we need to do, but patients need to feel that they've got the service, they feel a difference. Cataract surgery, we've reduced the wait time dramatically in cataract surgery, particularly in the northern part of the province, by having a surgeon, do that in his own clinic. And we've dropped the wait list down by months, if not years, down to now weeks or days. So that's one part of the province, but we can do that throughout the province. So I think what we're seeing is okay, let's just not get hung up on traditional, we can't do that. Let's have the frank discussion, with our union leaders, with associations, with doctors, nurses, all of the folks that actually see it every day. And let's start saying, okay, what can we do differently to make your work easier, but to make us to ensure we get better results to the patient.
It's almost as if you've lost confidence in the federal government to step forward. The way you're talking about looking for alternatives, if the dollars aren't there, you need to find a different way of moving forward. Is that an expression of giving up on the federal government?
Well, I hate to use the word give up as such, but I think we have to face the reality. We have what we have. And so we'll meet as COF team and we'll decide, okay, what's the next best step and where do we go from here? And then how do we work together to get better outcomes, and what have we learned from each other in their health delivery services? I think that's the conversation we'll ultimately get there. What more we can negotiate, what more we can do in terms of the bilateral agreements, that'll happen over the next few months. I would say not likely longer, and we'll get that resolved. I think the immigration file is huge. I think if the federal government we can pick that up, as I mentioned, let's get some reaction, because we have people retiring in New Brunswick. Again, our aging demographic, we see a bubble here we're going through, and we really could use a ramp up in the timing to source new healthcare professionals. So I think yes, at some point, we've been arguing for an increase in health transfer for 2.5 years now. So okay, we got what we got. Let's have the meeting and to see if there's more, what can we do about it. But then at the end of the day, after we have our meeting with all of our colleagues, it's okay, let's move on to what's the next best thing for us to focus on in order to ensure our healthcare system continues to improve. Because doing anything less is just not an option.
Quickly running out of time here, Premier, I am wondering when the next meeting amongst the premiers will be to try to formulate some type of either counter-offer or response to the Prime Minister.
Well, it hasn't been set yet, but I do expect it within a week.
Premier Blaine Higgs, again, always appreciate the time. Thank you for this.
You're very welcome. Have a good day.